I'm John Schmidt of SCTV, and I'm here today to do a Group of the Month video on the SHIIP program. And kind enough to cooperate in this program is Harry Ruth, a SHIIP volunteer. And I guess before we start, I might ask you just to explain SHIIP in a nutshell.
Well, SHIIP stands for Senior Health Insurance Information Program. Most states have such a program. Iowa was one of the first. The SHIIP program has been active in Iowa for 25 years now. We have over 100 sponsoring sites around the state where volunteers such as myself, who have been trained in Medicare and health-related matters, can work with folks to decide what course is best for them as they turn 65 and are eligible for Medicare.
For the bulk of the program today, I'm going to take advantage of the fact that I myself am 64, looking at 65, and the changes that it will make in my insurance picture and my Social Security picture. So I'll take the role of the client, and we'll try to do a sort of a generic SHIIP session, and which I'll introduce some of the questions I have in my own head, but also try to be general to questions that I think might be on the minds of other people. And I'm sure Harry will be very helpful in that also. But let me turn around and take the role of the client. I'm looking at my 65th birthday will be my next one, and I'm sort of got the vague notion that something has to change in terms of insurance, in terms of Social Security, and that my status is somehow changed, and that I need to be proactive in a way to just not let whatever happens happen, but to really look into it to an extent that I have not to this time. So I've called upon Harry as a SHIIP volunteer to give me some information, and I've provided him with some information that I don't know if it's exactly what he needs, but I have gone through and gotten my Social Security statement off of the website, and I've gotten some information about the drugs that I take, and I also have provided him with my with my current health care providers, and that I have Blue Cross and Delta Dental. Whether these things will be relevant or is yet to be determined, but this is sort of our starting point.
Well, John, you're spot on. When you turn 65, you are eligible for Medicare. In fact, if you don't do certain things, there can be penalties for not taking action. So you have to be proactive in this process. Let me ask first, do you plan to continue working after 65, or do you think you'll be retiring?
I am no longer working. I've retired.
You've already retired?
Yes.
Okay. Do you currently have health insurance somewhere? If you're retired, I gather you don't, but you might have health insurance through your previous employer as a retiree.
I have health insurance through my wife's employer, and she has since retired. So I think that something is likely to change one way or the other. But I have this insurance that I got through Kirkwood Community College, where my wife worked.
Well, if you still have access to private insurance once you turn 65, that's important, because you might want to keep that insurance and delay enrolling in Medicare Part B. There's several parts to Medicare. The first two are A and B, A being hospitalization, and Part B paying for doctors and laboratory work and so forth, durable medical equipment. But you can delay Part B if you've got insurance through another source, either through an employer if you're continuing to work, or you might have it through your spouse's employer. So we can come back to that, but something you will think about: if you have access to health insurance after you're 65, you may want to delay enrolling in Part B if you're comfortable with the insurance you've got now. But let's say that you're thinking of not continuing with your wife's health insurance, just so we can talk about options. With Medicare, there are two basic routes that you can go. The more traditional route would be to sign up for Parts A and B, and then you look for providers, and the providers could be your doctors, the hospitals, the laboratories, the outpatient services. You look for providers that have a contract with Medicare. Ideally, these are folks that, what they say, accept assignment. They have a contract with Medicare which says that Medicare, having an approved amount for all medical procedures, they accept that amount as payment in full. So this one route you would go, you'd have original Medicare, make sure that your doctor and your providers accept Medicare. Then you would need separately a standalone drug plan, and we can help you find a drug plan that's best for you. And then you probably are going to want a Medicare supplement plan. Medicare supplement plans are offered by private insurers. By federal law, there's 10 standard plans. In fact, if I can, let me go through a couple of charts here that I have. This is our Medicare supplement premium and comparison guide. This is a very handy document to have. We have them here in the office. You can take this with you, and anyone can come and get one. But normally what I do with clients is I start with this page here, and this page gives you a summary of what Medicare pays for and doesn't pay for. The top here is Part A, which includes hospitalization, skilled nursing facility care, home health care, and hospice care. The one to focus on here is hospitalization. If you are accepted as an inpatient in a hospital, you're going to pay the first $1,288 of those hospital costs. And this is just the hospital cost, not doctor's costs or any lab costs. After that, Medicare pays everything unless you're unfortunate enough to be in the hospital for more than 60 days. After 60 days, you have to pay what we call a copayment of $322 per day until you get out. If you're in for more than 90 days, that daily copayment goes up to $644. Part B, as I've said, is doctor services, durable medical equipment, laboratory test, emergency care. With Part B, the beneficiary pays the first $166 each calendar year. And after that, you will tend to pay 20% of remaining costs. Now that's a generalization, but basically Medicare is designed to pick up about 70-75% of the costs, and you have to pick up the rest. So that's why we talk about possibly a Medicare supplement policy, something that picks up part or all of what Medicare does not pay. On this page here, I have a summary of Medicare supplement plans. By law, there are 10 standard plans. So if you look at plans A through N, if you look at a plan A from any insurer, they're going to cover the same things. The premium may be different. These are private companies, but the coverage will be the same. With a plan A, that has the least coverage and therefore is the least expensive. And you can see here, this is what a plan A covers. Plan F is the most comprehensive, and it covers all of the costs that you see here. And then the other plans cover something in between. So with a plan F, the most comprehensive, you can probably expect to pay $100, $125 a month when you're 65, maybe more. Women would pay a little bit less. But this Medicare supplement plan helps you pay what Medicare does not pay. Now this has all been one option for you. There's a totally separate option we call Medicare Advantage. Medicare Advantage is offered by private insurers. They have contracts with the federal government. to administer Medicare benefits to you. The benefits available to you under original Medicare or Medicare Advantage is the same. But with Medicare Advantage, the deductibles and the copays can be different. One of the advantages of Medicare Advantage is that the premiums are going to be less than you would probably pay going with a drug plan and a Medicare supplement plan. In Iowa City area, premiums can be as low as $0. And this covers both drugs and medical. The disadvantage of Medicare Advantage plans is that around here they tend to be HMOs or PPOs. An HMO is a health maintenance organization. And if you want the company to pay for your benefits, you have to stay in their network. You have to make sure the doctor you use, the hospital you use, the laboratories you use, all are in their network, or else you have to change providers. So your upfront cost, your monthly premiums will be less, but where with original Medicare and a Medicare supplement plan, you could have almost all of your costs covered. With a Medicare Advantage plan, you're going to pay something out of pocket. You're going to pay more in what we call co-payments. So you pay less up front, but you're going to have more costs as you go forward. If you're relatively healthy, you might like the idea of a Medicare Advantage plan. Or if you don't mind a certain amount of financial risk, where you're going to take money out of your pocket, but you're not sure how much. If you're not comfortable with that, you might feel better with the original Medicare, the drug plan, and the Medicare supplement plan. There you're going to pay more in monthly premiums, but your out-of-pocket expenses going forward will probably be less. Other advantages of Medicare Advantage is that you can have certain things covered that Medicare does not cover. You can get free membership to a health club. You can get certain limited benefits for hearing, vision, and dental, which you don't get through original Medicare. With the Medicare Advantage, you have a maximum out of pocket. That can be as low as $3,900 a year or as much as $6,700 a year right now. But again, there's kind of a cap. You may pay more out of your pocket, but there's a cap on how much you pay annually. So again, you've got to make a decision. Are you more comfortable taking a little bit more risk and paying a little less money up front? Or do you want just the security of paying a little more up front but knowing that you're not going to have to take money out of your pocket very often going forward? Does that make sense to you?
Yes, it does. Now, I guess I would wonder if this is just a dollars and cents equation, and you just kind of figure out what is the cheapest, or is there more of a security blanket with some plans than others, or how optimistic you are about the future or something might be?
Well, unfortunately, when you get to your age and my age, you're always betting on how healthy you're going to be, or for that matter, how long you're going to live. But it's an individual decision you make. If you want the security of knowing that, I'm not going to get surprised financially very much. You might want to go with original Medicare, the standalone drug plan, and the Medicare supplement plan. If you're healthy and you think you're going to stay healthy and you want to pay less each month, a Medicare Advantage plan may be better for you. That's why I say no one can make decisions for you. You've got to decide what are you comfortable with. There is no right answer for any given person. Financial risk, comfort with financial risk is a major issue. Other things also, Medicare Advantage is geographic specific. They want you, if you get a Medicare Advantage plan, they kind of want you to get your medical care here in Iowa City. Now, if you're traveling, you can get emergency service somewhere else. But if you go to Florida or a snowbird of some sort, and you go off for 2, 3, 4 months in the winter or more, Medicare Advantage is probably not for you because you're going to have trouble getting covered. Original Medicare, you can find just any doctor, any provider in the country that accepts Medicare, that has a contract with Medicare. You can go to that person regardless of where you're at. So that's something to look at also. If you're going to do a lot of traveling, Medicare Advantage has some disadvantages. You might want to go the other route.
So, except Medicare, how big of a hurdle is that? Are there doctors and hospitals out there that don't do Medicare at all?
Yes, yeah. We're lucky here in Iowa City. I think most providers have contracts with Medicare. They do business with Medicare. That doesn't have to be true everywhere. We would like to think it's true in most places, but you've always got to ask. Do you accept Medicare? Do you accept assignment? Will you accept payment in full from Medicare for services you provide me? You start out by saying, there are things I have to do when I turn 65, and the answer is yes. Perhaps you've had a private insurance through your employer for much of your life, and you just sent them the bill and they took care of most of it. You didn't have to worry about it. I'm afraid when you're 65 and you're eligible for Medicare, there are decisions that you've got to make, and there are consequences if you make the wrong ones.
And is there, with this idea of keeping your insurance past 65, is that always going to result in putting out more money than using Medicare? Is that or generally so, or?
Again, I'm afraid generalizations are not very are not true. One thing we need to do is to be familiar with the medical packages that are available to people, to retirees, if you will, after 65. It could be that you are with the University of Iowa, and they have medical insurance available to retirees. And we're pretty familiar with that because we need to be, because you need to decide if you have access to what they call a Medicare carve-out plan from your employer or previous employer. You need to decide what's better for you, to go with Medicare or to stick with that plan. So it's important for us to understand what insurance is available to people after 65, so we can explain to them the advantages or disadvantages of staying with that insurance versus postponing enrollment in Medicare Part B until a later date.
So one thing that's in the news a lot is these drugs that have suddenly skyrocketed in price. I mean, is there something that you can do to dampen this? I mean, does Medicare address that kind of thing, or in any way?
That's a complicated question. Let me say no, probably not. Again, with Medicare, they have a drug benefit, but you have to get it through a private insurer. So, and these insurance companies deal with the drug manufacturer. So if they up the price, those insurers are going to pass that cost along to you. Most insurers will do things to encourage you to use less expensive drugs. Any drug plan for retirees, for any Medicare standalone drug plan, is going to have co-payments. In other words, if you go to your pharmacist and fill a prescription, you're going to have to pay something out of your pocket for that drug. The plans would encourage you to use generics, because generics are cheaper than brand drugs. The insurance companies, they have probably better deals with some manufacturers than others. So they may have a preferred generic with a very low copay and a non-preferred generic with a slightly higher copay. And likewise, they will have a preferred brand drugs they carry or they insure, as opposed to non-preferred drug plans. So what we have, and we can go through this if you want, there's a public website called Medicare.gov, and we can go in there and we can enter the drugs, the specific prescriptions that you've got, and then look for the most cost-effective drug plan that would be cheapest for you. And as you can tell, this is Medicare.gov.
Uh-huh.
I'm going to look in this green button here, Find Health and Drug Plans, and I'm going to click on that. Now, we're going to do a general search. If you already had your Medicare card, we could do a more personalized search and maybe get some more information. But you have not applied for your Medicare card yet, probably.
Is there a,
There's a window.
okay.
Pardon me for interrupting, but you're right. There's a window. You should apply if you don't have insurance from other sources, from your wife, your spouse, or your employer or ex-employer after 65. You've got a window of 7 months. You should apply the month you turn 65, the 3 months before you turn 65, or the 3 months after you turn 65.
Okay.
We encourage people to enroll in Part B before the month, in the 3 months before they turn 65. If you delay, if you enroll later, there may be a delay in your benefits taking effect. You might have a gap if you had health insurance up to 65. But you've got a 7-month window, and it's very important that you apply for Part B in that time, assuming you don't have insurance from other private sources. You probably want to enroll in Part A also. In your case, it sounds like we've worked for more than 10 years or 40 quarters in your life.
Mm-hmm.
So Part A Medicare will not cost you anything. So I would encourage you to go ahead and enroll in Part A as soon as possible. Part B is going to cost you something. It's going to cost you about $121 a month when you enroll. And by the way, they can take that out of your Social Security check if you're drawing Social Security, or you could set it up to pay, the government directly. Either way. But again, Part B, if you don't have other sources after 65, you're going to want to enroll in that 7-month window. Likewise, you got that same 7-month window to enroll in a drug plan. So let's go through this and do a search. Can I ask you what zip code you live in?
52245.
Okay. And we're going to click on Find Plans. And I've got a page I'm just going to click through. You don't have Medicare coverage yet. And I've already talked to you, and your income is such that you're not eligible for special financial assistance from Social Security. So you don't get any extra help, it's called. So we'll continue on. And now we got to enter your drugs. So you have a list of your prescriptions?
I do. These are the two that I've bracketed are the ones that are regular. The other.
Okay. Okay, those are the 2 drugs you take, right?
Right.
All righty. And I notice they're both already generic, so that's good news.
Uh-huh.
And I'm going to click that your drug list is complete. Okay, now I want to write something down. We'll capture this information again later, but that drug list of yours has an ID number. So I'm going to write down that number just in case we could get kicked out of this site for some reason before we get to the end. And you've also got a password date, which is today's date, February 23rd, 2016. So I'm writing that down in case I may need that later. Okay, now we need to look at pharmacies. What pharmacy do you tend to use?
I tend to use the Walgreens on First Avenue.
Okay, what I have here, I've drawn up a list of all pharmacies within 13 miles of your zip code. Look at. You haven't decided. You have not expressed a preference between original Medicare, standalone drug plan, and Medicare supplement versus Medicare Advantage. So I am going to get a list of both types. Clicked on both of them there, and I'm going to continue to plan results. Okay. Here we are. They always list original Medicare, which doesn't cover drugs. So if you had to buy all your drugs on the retail market, they're estimating you'd pay about $1,161 a year for that. But let's look at drug plans first, standalone drug plans. Okay, they tend to list these by cost. So you can see here, this first drug plan would cost you $320 a year, they think. And that's a combination of the $25.70 premium each month and the copays, and we will see what those copays are in a minute. The next cheapest drug plan is $356 a month, not a whole lot more, but why pay more if you don't have to? I came here to the Senior Center. The first thing I did was to listen to a presentation on Welcome to Medicare, which we give here about every other month or so. And frankly, I was totally overwhelmed. And the counselor, and I went to see a counselor like me. I went to see a counselor here, and as part of the process, he said, "Hey, you know, you might think about being a counselor yourself." And my thought was, I can't make decisions for myself right now. I would never try to, you know, advise someone else as how to proceed. But you know, I've been around government programs much of my life. I worked in the federal government once upon a time. My last 25 years, I worked for an electric cooperative, which can borrow from the federal government as a nonprofit. So as I thought about it, I said, look, I've been around government programs, you know, and they're all complicated. So if I can master other government programs, I should be able to master Medicare. People appreciate it. I've never had anyone say, "Boy, you did a lousy job." You know, they always thank me because apparently I've helped them steer them in the right direction.
Well, and in substitute for our own thank you note, we want to thank you very much for being part of our program today. I think you've given a lot of great information, and I think it will encourage people to proceed and use your services.
Okay. In closing, let me say that there's 6 of us here at the Senior Center. And in fact, I think we've recruited a 7th person, which might start in the fall. There's generally someone here, you know, every workday, Monday through Friday. Maybe not for 8 hours, but, you know, there's always someone here. When we have that open enrollment period from October 15 to December 7th, there's at least 2 of us here every day, and that's for 8-hour periods. So there's somebody here. If you're interested in setting up an appointment to see us, call our front desk. That's 356-5220, and they'll take your name and your address and set up an appointment, so you can meet with someone like me.
Okay. Well, thank you again, Harry.